Pill crushing is part of the task that nurses are involved with. And for some, this can become a tedious process. They get into what's called the RSI, or the repetitive strain injury category. Some call it the cumulative trauma injury or disorder. It's essentially using the same kind of muscles, same joints to perform the same tasks over and over again. And so there's some wear and tear that sets in, some amount of inflammation, and can be debilitating at times. So we looked for an ergonomic design for pill crushing. We found some in the market that seemed to do what we thought was an ergonomic design, but it still didn't take away the actual manual process of crushing the pill. That's when we decided we need to find something else, and looked around to see if there's a electronic version of it or a not manual version of it, and we happened to chance upon SafeCrush.
I was crushing meds, and we have, chronic care patients that have a multitude of comorbidities. So it's not like you're crushing one pill. You're crushing 14, 15 at each med pass for each patient. And at the end of the day, I would have numbness in my fingers. I would have difficulty with my thumbs, weakened grasp. And I had gone to occupational health at my place of employment, and they referred me to therapy, which I did go to with only minimal relief, however. I then had to have a nerve conduction study, which showed the carpal tunnel, moderate to severe in both hands. Had that fixed. I still have a lot of atrophy to the muscles in my thumb. I have a new ganglion cyst that's very tender. I still have weakness. I mean, once you have atrophy to that muscle, it doesn't usually come back to the degree where you had been prior to the injury. My elbows are very tender still with the scar tissue. And again, just general weakness with my hands and the hand strength. But I'm so happy to have SafeCrush. We just couldn't wait to get this machine. And I use it anytime I'm on the floor, and I honestly don't know what I would do if we didn't have it today. My job in crushing meds, going back to manual after the 2 surgeries, would be very difficult for me to perform without this being available to me.
I've never been affected by the manual pill crushers with repetitive strain injury. I don't know if it's due to the fact that I've only been doing it for 3.5 years, but my supervisor, Nancy, she actually had to undergo surgery for carpal tunnel due to the manual pill crushing. And I know it always put a strain on her elbows, and by the end of the day, she'd be holding her elbows, and it really took a toll on her.
Again, it's so nice to leave every day when you do have a full patient assignment, and I don't have the aches, and I don't have the worry anymore if I did more damage to my hands or to my elbow. So it's been wonderful, and thank you.
I had to have a surgical procedure in my neck. I had a disc replaced, my C6-7 disc replaced due to a herniation from repetitive pill crushing.
Well, I myself have crushed my finger while trying to crush pills with our original pill crusher. I know a lot of my coworkers have done that too. Carpal tunnel, tendinitis from constantly pushing, the old pill crusher.
So we've been using manual pill crushers here as long as we can remember, and we've had a lot of injuries, a lot of dissatisfaction with the products that we're using, so we contacted SafeCrush to help us solve this problem.
I have seen nurses go through carpal tunnel surgery. I've seen them actually had to change careers because they could no longer do it. Most of the injuries are carpal tunnel, smashing your fingers on some of our metal pill crushers. It's a nuisance for the nurses, the staff. It's also a nuisance for our population, our patients, because it's noisy. You have 3 shifts that you're covering, and you're out there banging. And I mean, if you've ever been on the units and hear the metal pill crushers, it's loud. So have I experience and know of people that have been injured, quite a few.
But in the 2 years that I've been here, I've seen nurses with carpal tunnel injuries, shoulder problems, elbow issues, and we've had several surgeries conducted on our nurses that is directly related to manual pill crushing.
Long-term disability due to pill crushing, yes. I think, unfortunately, if left untreated, or some of them don't respond to the conservative forms of treatments, then yes, it becomes part of the process to get better, and it can get expensive and long and tedious for all parties involved. So I think our goal is to, one, be proactive, prevent that, and two, if it were to happen, then provide the best care we can, and that sometimes does include, long rehab, surgeries, injections, things of that sort.
And as an organization, we feel very happy that we've been able to provide this to our nurses to keep them safe.
Our goal is not to treat them so much as to prevent this process. So catching them early is our best opportunity.